Mrs. Anjali is 24 years old and has come to the sub-centre for her first antenatal visit. She is a primigravida and is approximately 12 weeks pregnant. She feels well, but she is slightly anxious because this is her first pregnancy. Her ASHA worker has accompanied her for reassurance and support. The healthcare provider welcomes Anjali warmly, ensures privacy, makes her comfortable, and begins by asking how she is feeling and whether she has noticed any unusual symptoms. She explains that most pregnancies progress normally, but every pregnant woman and her family should know the danger signs so that they can seek care without delay. The first important warning signs are vaginal bleeding, severe abdominal pain, and leaking of fluid from the vagina. Any bleeding or spotting during pregnancy requires medical evaluation. Severe or persistent abdominal pain, worsening cramps, passing clots, or a sudden gush or continuous leakage of fluid should never be ignored. Anjali should not wait for these symptoms to settle, take medicines on her own, or depend only on home remedies. She should inform her family or ASHA worker and immediately go to the nearest health facility. The healthcare provider next explains the warning signs associated with high blood pressure and pre-eclampsia. A severe headache that does not go away, blurred vision, flashing lights or spots before the eyes, sudden swelling of the face or hands, and severe pain in the upper abdomen, particularly below the ribs, require urgent assessment. Regular antenatal visits are therefore essential for monitoring blood pressure, weight, urine, and the general health of both mother and baby. Anjali is also counselled about signs of infection and dehydration. High fever, chills, burning or pain during urination, foul-smelling vaginal discharge, or severe vomiting that prevents her from retaining food or fluids should be reported promptly. Persistent vomiting may cause dehydration and weakness, while fever or urinary symptoms may indicate an infection that needs medical treatment. She should drink adequate safe water, maintain personal hygiene, and avoid self-medication. Some symptoms are medical emergencies and require immediate referral. These include convulsions or fits, severe breathlessness, fainting, loss of consciousness, inability to stand, sudden collapse, or extreme weakness. If any of these occur, the family should arrange emergency transport and take her to the nearest appropriate health facility without delay, with assistance from the ASHA worker or ANM. Although Anjali is currently only 12 weeks pregnant and is not expected to feel fetal movements yet, she is counselled about danger signs that may become important later. After she begins to feel the baby move, usually around 5 months, a noticeable reduction or absence of fetal movements must be reported immediately. Persistent severe headache, sudden swelling, breathlessness, bleeding, leaking fluid, fever, or severe abdominal pain can occur at any stage of pregnancy and should always be taken seriously. The healthcare provider then explains what Anjali should do if she develops any danger sign. She should not wait for the condition to worsen. She should inform her family or ASHA worker, go immediately to the nearest health facility, carry her antenatal card and previous medical records, and use emergency transport when required. To confirm understanding, the healthcare provider asks Anjali to repeat the important danger signs and describe the action she would take. Anjali responds that she will seek care immediately if she experiences bleeding, severe pain, leaking fluid, severe headache, blurred vision, swelling, fever, persistent vomiting, breathlessness, fainting, convulsions, or reduced fetal movements later in pregnancy. Before concluding the visit, Anjali is advised to continue regular antenatal checkups, eat a balanced vegetarian diet containing pulses, vegetables, fruits, milk or suitable alternatives, and iron-rich foods, and drink adequate safe fluids. She should take iron and folic acid supplements as prescribed, have her immunization history reviewed, and receive TD vaccination according to the recommended schedule. She should get adequate rest and avoid tobacco, alcohol, unprescribed medicines, and harmful substances. The support of her family and ASHA worker can help her attend appointments, follow advice, and obtain care quickly during an emergency. The key message for Anjali and every pregnant woman is simple. Know the danger signs, do not delay, seek care immediately, and continue all scheduled antenatal visits. Early recognition and timely care can protect the mother, protect the baby, and help ensure a safe and healthy pregnancy. Case step content is for education only and does not replace clinical judgment or applicable guidelines.